Used to be the ED in that home, so I'm well aware of their recruiting challenges. How many people here have been to Osoyoos? Ooh, lots. What did you go there for?
Wine.
I heard wine loud and clear. So most people are aware that Osoyoos is a retreat community. Most of the people that live in Osoyoos are retired. So this poses its own set of challenges. The group that I'm going to be speaking to today works at Mariposa Gardens, and Mariposa Gardens is a fairly large care home in a small community. We have 145 residents that live there, spanning from independent living to assisted living, residential care, adult day programming. We also have a Meals on Wheels program, so it's a real community hub. And we have over 100 volunteers. Lots of them are retirees, obviously. And we have 160 team members. And the population of Osoyoos is 7,000, but in the summer months, the population doubles. So that in itself poses a set of challenges. Here's a picture actually of the July 1st parade. Many of you have probably gone to the July 1st parade in Osoyoos. It's a great event, and here's one of our team members. And if you can see the sign that she's wearing, it says Mariposa Gardens is a great place to live and work. And that's what the team members strive for at Mariposa Gardens. They're extremely dedicated, especially the core group of team members that have been there for several years that helped to open Mariposa Gardens in 2008. Some of them even did their training on site, because we do have an on-site RCA course at Mariposa, and have been working there ever since. But one of the challenges they face is that they're continually working short, and obviously from the comments previous, everybody's having the same challenges. So they're working short, but they're also working lots of double shifts because they're very conscientious about making sure that all of the residents have the care that they need and deserve. So as they work these continuously long hours, people are getting tired out, as you can imagine. But they're doing a really great job. If we look at their indicators, we look at their employee survey, their resident survey results. We look at their IH quality reviews, their licensing reports, all of our internal audit processes, all point to good quality of care. The only indicator that is not favorable is employee engagement, which makes sense when you're working long hours. So in spite of these challenges, the team does a fairly great job, and I think we have to commend them for that, but they are getting tired out, they are aging, and we're seeing less and less applicants. So in 2008, when we first opened, we started an in-house RCA certificate program in partnership with Sprott-Shell College. So the classroom is actually in the basement of Mariposa Gardens, and they do their practicum placements on site. In that first class, we had 26 participants. We've run a class every year since then, and typically we'll have anywhere from 5 to 8 participants in classes. So the enrollment has really gone down over the years. So we're noticing the same trends that everyone has been speaking to this morning. So the lack of qualified applicants. There's also a bit of a challenge because we are a private healthcare provider, and our wages are not competitive with health authority wages or benefit packages. So quite often we will see people leaving for that reason. Oliver is just down the road, only a 15-minute drive, and there's 2 health authority sites there. So some of the people that we train and some of the people we hire end up moving on and working for the health authority. So it's an important reality that we have to address. There is a steady decline, of course, in the RCA enrollment. And there's a lack of childcare. So even if people are interested in moving to the area, we can guarantee full-time working hours. There is a lack of childcare and public transportation. There's a lack of affordable year-round housing because it's a retreat community. Many of the people that rent out their homes do so or their apartments on a seasonal basis, so it's not year-round, so that can be a challenge. And there is limited opportunity for family members, so if you have one spouse that wants to move and work as a nurse or an RCA at Mariposa, it's very difficult for their partner to find employment. And we do see a perceived imbalance between the demands of the job and the compensation rates. We hear that all the time. We know that a third of our RCA team members are going to retire within the next 5 to 10 years, which is really quite frightening, because in order to just maintain staffing levels, we need to hire at least 54 to 60 people at Mariposa every year. So, on the bright side, we believe there are solutions. And one of the things that we've done recently, which we're very excited about, is we are able to offer a bursary to anyone who's interested in participating in the on-site training program through Spratshaw. There are conditions, of course, with the bursary where we would expect them to work with us for a certain period of time to commit. We have provided temporary assistance with accommodations, and that seems to help since housing costs are so high and rental properties are few and far between. And we do provide an employee referral incentive program, so if we have a referral from an employee and the new person that we onboard is successful and stays more than 3 months, then we would pay that employee $500 for the referral. So we're trying all sorts of creative solutions. We are in the process of recruiting more international educated team members. However, they will only have work permits, so it is only a temporary solution. We also created a new position called a comfort and support worker, and this doesn't replace an existing position. It's a complement. So if we're working short, or if we notice that people are fatigued because they've been working extra hours, we would implement this shift. And basically what they would do is they would help with companionship, redirecting residents, talking to family members, maybe helping with light housekeeping, making beds, all of the things that you don't necessarily need an RCA certificate in order to perform. And it does, we are finding this does help with morale and also safety. And this was mentioned before, but we do concur that if there was a student loan forgiveness for RCAs working in remote areas, that would be a huge plus. We think that would make a big difference. And we're obviously, Sienna Seniors Living is a large organization, has a great social media platform, and focuses a lot of energy on branding. So that's one of the things that we focused on too, and launched a national social media campaign. However, we're not seeing a lot of results, and I think that speaks to just some of the perceptions out there about people working in healthcare. So, and this is my last slide. And this is just to, and I'm speaking on behalf of the folks at Mariposa Gardens, because this is really what it's all about, is the resident. And you know, if we don't band together and set our own agendas aside and really work together as a healthcare sector, these are the people that are going to suffer in the end. So thank you.